Hi, Dr. Ramsey Choucair. I'm a plastic surgeon in Dallas, Texas, and today we're doing a series of talks on body contouring. And the first concept is, well, what's new when it comes to body contouring? There's many new technologies that allow us to reduce fat without surgery. So how good are they? Well, the first in the series is to compare liposuction or suction-assisted lipectomy, which is our traditional way to remove fat, with non-surgical options. And there are several non-surgical options out there, whether they be a radio frequency type energy or a laser type energy, or the one that we've used for almost 5 years, which is a freezing type process called, for better term, that CoolSculpting term that is now being advertised everywhere and really has significant validity. So what's the difference between non-surgical and surgical treatment? Well, quite simply, non-surgical treatment is simply not going to create the same improvement as surgical treatment. That may seem obvious, but that's the most important first point. Second, non-surgical treatment usually means that you'll have to have several treatments, more than one session. In general, these are all generalities because each person is different. Liposuction, or like suction-assisted lipectomy, usually the initial treatment is going to be the significant change with one procedure, not usually multiple procedures. So how does CoolSculpting work? Well, quite simply, the cooling device freezes the fat for a period of time, and then after a period of 2 to 3 months, in general, the body dissolves the fat that's been frozen, which destroys the fat cells, and the body carries away the fat cells, and you see the improvement. Typically, the way CoolSculpting works is about 20% of the fat that is pulled into the device is what is permanently removed. With liposuction, figure that this is the muscle and this is the skin. We take about 80 to 90% of all the fat. So there's a significant difference in how much fat can be removed with liposuction versus a technique such as CoolSculpting. The other techniques, whether it be laser or radio frequency, many times reduce even less fat than CoolSculpting. So in general, the big difference is how much fat can be removed and how many sessions are required. Now, the idea of dangling non-surgical treatment in front of anybody is obviously desirable. So CoolSculpting and non-surgical treatments have a great benefit for those who don't want to do surgery. But the bottom line is always, what does the patient expect? And expectations not met always lead to a little disappointment. So if you're going to consider body contouring with non-surgical techniques, make sure you know the difference of what you're going to get, and make sure your surgeon explains to you exactly the pros and cons.